Hey guys, I am Asia, the nurse doc tutor, and I just want to thank you for tuning into my channel. So today's lesson will be on heart failure. So if you are struggling to understand left-sided heart failure, right-sided heart failure, this is the video for you. And guess what? Don't be stingy. Share this video with your classmates so you all can pass your exam. So what actually is heart failure? Well, in simple terms, when your heart fails. But the definition that I have is when your heart isn't able to pump blood as it should. This can happen because the heart becomes too weak or stiff, making it harder to get enough blood to the rest of the body. So like I said, in simple terms, when your heart starts to fail, your heart does not do the job that it was supposed to do. So what are some things that can cause heart failure? If you have any heart arrhythmias such as tachycardia or atrial fibrillation, recreational drug use. So the two that I really want to talk about is problems with your heart valves and uncontrolled hypertension. So what is your heart valve? So a heart valve is a one-way gate in the heart that helps control the flow of blood. So we have four heart valves, right? We have your aortic, your mitral, your tricuspid, and your pulmonary valve. So each one opens and closes to let blood flow in the right direction, preventing it from flowing backward. These valves help the heart pump blood effectively throughout the body. If the valve does not work properly, it can lead to issues like blockages or leakage. So with our patients that have problems with their heart valves, if they have regurgitation, this causes the blood to backflow, and if they have stenosis, this is narrowing of those valves that increase the pressure through those valves. If a patient has uncontrolled hypertension, meaning they don't take their blood pressure medicine, they simply don't even know they have high blood pressure, they don't eat right, this can lead to stiffening of the heart walls and causes the ventricles to become stiff. So I hope that this makes sense, gave you a little anatomy lesson about how the heart valve actually works, and if you have narrowing or if you have your valve is not closing like it should, how it can affect your heart's function. So today we're going to talk about the two types of heart failure. We got left-sided heart failure and right-sided heart failure. So with left-sided heart failure, this occurs when the left side of the heart cannot pump blood efficiently through the rest of the body. So the left ventricle is responsible for sending oxygen-rich blood to the organs and tissues. It becomes either weak or it becomes stiff. As a result, blood backs up into the lungs, causing fluid buildup, which can lead to shortness of breath, coughing, and fatigue. So the cheat code to how to remember left-sided heart failure is that this patient is going to be experiencing respiratory pulmonary symptoms. So your patient is going to have a hard time breathing. Your patient is going to have pulmonary congestion, such as a cough. They may have crackles. They may have wheezing. They may have blood-tint sputum. So remember, they may have stenosis, right, from not getting enough oxygen. So just remember, when you're talking about left-sided heart failure, it's because now the left ventricle is not doing what it's supposed to do, and it's now allowing blood to back up into the lungs. All right, so let's talk about right-sided heart failure. So right-sided heart failure means that the right side of the heart cannot pump blood well to the lungs. So this causes blood to back up in the veins, which leads to swelling in your legs, your ankles, and in your belly. So the signs and symptoms that your patient may experience is feeling tired, gaining weight, or having extra fluid on them, which is edema, right? And this patient could complain of shortness of breath. But what you will mostly see in this patient is you will see it in their extremities, or you will see it in other organs. So your patient will have dependent edema, right? The patient will have swelling in their hands and fingers. You will see jugular vein distension. You also will see ascites, right? The patient could have a large spleen or liver. So it is so important to know that in right-sided heart failure, you're then going to see fluid in organs or in your extremities. So, how is this diagnosed? So, medical history and physical exam. So, if your patient are presenting with these signs and symptoms, this could help the physician to make them want to run more tests. But X-ray could be used to show if the heart is enlarged or if there is fluid buildup in the lungs. The echocardiogram. This test shows the sound waves to create images of the heart showing how well it is pumping or if there is any strain. EKG, this records the heart's electrical activity and can show if there has been damage or stress to the heart. We can do different type of blood tests, but one blood test that we do is your BNP, and this can be elevated when the heart is under strain. So if the patient has a BNP level of 300 or more, then it is suggesting that that patient could have heart failure. So what are we going to do to treat heart failure? So medications. So medication is going to be the big thing. So we're going to give diuretics to reduce the fluid buildup, right? We're going to give ACE inhibitors or ARBs to lower the blood pressure and the strain on the heart. We're going to give beta blockers to slow the heart rate and improve the pumping. We could give aldosterone antagonists to reduce your fluid retention. And we could give digoxin to strengthen your heart contractility. All right, also you want to teach your patient about lifestyle changes, such as a low sodium diet, regular exercising, losing weight, quit smoking, limiting their alcohol, different type of procedures that the patients may need, depending on the severity of their heart failure. Is they may need a pacemaker, they may need an ICD to regulate the heart rhythms. They may even need surgery. They may need a valve repair, bypass surgery, or they may even need a ventricular assistant device. So it just depends on the severity of the patient's heart failure. And if they're in advanced heart failure, they will need a heart transplant. So the biggest thing to know that we're going to use a bunch of anti-hypertensive and a bunch of diuretics and digoxin just to help ease the strain on the heart, to not have the heart work so hard. And remember, we want to teach our patient those lifestyle changes, that they need that low sodium diet, exercise, lose weight, stop smoking, stop drinking, and things like that. All right, you guys, and that's the lesson. So I hope you now have a better understanding of left-sided and right-sided heart failure. If you would like me to be your personal tutor, my information is on the screen. So follow me on Facebook, the Nurse Doc Tutoring Service. I have a Facebook group where I post videos and I post NCLEX questions every day. Follow my TikTok. I post NCLEX questions throughout the entire day, videos throughout the entire day. Definitely a fun place to be. But if you enjoyed this video, share it with your classmates. Share it with other nursing students so you all can learn together. If you haven't subscribed already, I don't know what you're waiting on. Go ahead and like, comment, and subscribe. And I just want to thank you guys for watching. If you are in nursing school, you can make it. You can make it. Keep going.